Personality disorders. Introduction. You will learn about how personality is defined. You will also learn about the various types of personality disorders which patients can suffer from. There is a wide variety, and all are characterized in different ways. We will discuss some of the causes, symptoms, and treatments for them. Please remember that medication can only be prescribed by GPs, psychiatrists, or nurse prescribers. Topics to be covered: personality and personality disorders, antisocial personality disorder, avoidant personality disorder, borderline personality disorder, dependent personality disorder, histrionic personality disorder, narcissistic personality disorder, obsessive-compulsive personality disorder, paranoid personality disorder. Personality and personality disorders. Personality is the thoughts, feelings, and behaviors that define who you are. Your personality is defined when you are a child. It may alter slightly as you grow and have new experiences, but most people's personalities are fixed and will not change significantly during their lives. All personalities contain some negative traits which we will occasionally show when we have reason to. This might be because we wish to avoid doing something or we want to conceal something. Sometimes we use them in unreasonable ways, but this should be relatively rare. Someone with a personality disorder displays the negative traits in extreme ways and cannot significantly prevent themselves from doing so. Antisocial personality disorder. Antisocial behavior is a term you may recognize. When applied to a personality disorder, it means that the person is aggressive towards others, behaves impulsively, and doesn't regret harming others. The person might also ignore rules and the rights of others. This can lead to problems in school and later in life if they don't find ways to address the behavior. Causes. The causes of antisocial personality disorder are not known. Some researchers think that it may result from reduced inhibitions. This would lead to the person behaving however they want, without caring how others view them. Some researchers believe that exposure to certain negative experiences, such as poverty, crime, instability, and isolation, may contribute to antisocial personality disorder. A few believe that an abnormality in the prefrontal part of the brain could also predispose someone to antisocial disorder. Symptoms. Apart from a disregard for rules and the rights and well-being of others, antisocial personality disorder has many symptoms which can help with diagnosing it. Not all need to be present for the disorder to exist. The symptoms could include arrogance, crime, inability to plan, callousness, manipulative behavior, lack of emotions, power hunger, destructiveness, recklessness, deceitful behavior and lying. Treatments. A person suffering from an antisocial personality disorder can often be helped through various types of therapy. If they don't receive treatments, they are at risk of unemployment and imprisonment, depending on how severe their behavior is. Commonly, the disorder is treated through one-on-one psychotherapy, with a focus on exploring emotions and why the patient does not seem to feel them. This sort of therapy is often effective if reasons to overcome the behavior can be found. Group therapy with others who suffer from an antisocial personality disorder. Avoidant personality disorder. Patients suffering from avoidant personality disorder are often focused on the negative aspects of any situation. They may suffer from low self-esteem and lack confidence. It often leads to social withdrawal. Often, the patient may have social anxiety and struggle to communicate with others. This usually stems from a fear of being deemed inadequate. Many people suffering from this disorder don't seek help to overcome it. Treatments can be very effective if they are provided. Causes. Determining a cause for an avoidant personality disorder is problematic. Many researchers believe that it may be the result of a child's temperament. They believe that a timid child may be predisposed to avoidant personality disorder. Shy children who withdraw from social situations will grow up lacking the necessary skills to communicate well with others. Rejection from others may be a contributing factor. Other researchers believe it may serve as a defense mechanism to prevent overstimulation from external factors. Symptoms. Avoidant personality disorder can be diagnosed through the appearance of various symptoms, including low self-esteem, anxiousness, shy disposition, perfectionism, distrust of others, avoidance of socialization. Many people who suffer from the disorder are particularly wary of new activities, which present unknown challenges. They may also suffer from poor or unsuccessful relationships due to the lack of self-esteem. Treatments. Successful treatment of avoidant personality disorder often involves psychotherapy. This may need to be one-on-one to overcome the confidence issues which the patient faces. Unsurprisingly, many sufferers do not seek treatments or help. Psychotherapy should address the specific issues which the patient struggles with and focus on building confidence. Patients may also be given NADL to help increase their confidence and assertiveness. This can help patients suffering from moderate or severe problems. Borderline personality disorder. Borderline personality disorder is characterized by major emotional instability. This may appear as sudden mood swings and impulsiveness. Criticism may lead to a patient acting negatively and even violently. Patients with borderline personality disorder often feel they have been treated unfairly. They may start to perceive another person as entirely good or entirely bad, which is known as splitting. This disorder can lead to substance abuse and even suicide if not treated. Causes. The causes of borderline personality disorder are unknown. Some researchers believe that patients become overwhelmed by emotions, meaning that they are unable to cope and behave in rational ways. It is possible that experiencing a major loss, particularly early in life, may contribute to borderline personality disorder. Some researchers have also suggested that the frontal lobe of the brain may not be functioning correctly. Decreased serotonin levels may also have an impact. Symptoms. Borderline personality disorder can manifest in many different ways. Apart from the symptoms already mentioned, this disorder can result in unstable relationships, fear of being abandoned, paranoia, self-destructive actions, a dislike for being alone, angry outbursts, impulsiveness without regard for consequences, clinginess, sense of emptiness. People suffering from this disorder may also be violent towards others. Treatments. There are multiple treatments which can be offered to patients suffering from borderline personality disorder. These include psychotherapy, one-on-one therapy sessions with enforced limits designed to help the patient relax, partial hospital programs, day programs which groups of patients attend, with 5 sessions per day. Each session will have a particular focus. Dialectical behavioral therapy, group and individual sessions which focus on teaching skills and coping techniques. Medication, such as naltrexone, Zyprexa, olanzapine, Escalith, lithium, Buspar, Buspirone, Depakote, Valproate, or Risperdal, Risperidone. Dependent personality disorder. As the name suggests, dependent personality disorder is when a patient transfers their responsibilities to another person and heavily depends upon them. The patient is likely to suffer from serious self-esteem issues and will often seek protection from others. Dependent personality disorder has a very negative impact on the patient's relationships, and the patient is often very sensitive to even mild criticism. Causes. Some researchers believe that dependent personality disorder may stem from parents who were very protective or very strict. A child not given enough independence and belief in themselves might develop dependent personality disorder because they have not had opportunities to test their own abilities. It is thought that child abuse or major childhood trauma may also contribute to dependent personality disorder. Symptoms. There are some clear symptoms of dependent personality disorder which can make it easier to detect. Remember that a patient may not show all of these symptoms. Symptoms include difficulty making decisions, clinginess, fear of losing the approval of others, insecurity, submissiveness, need for praise and approval, fear of being alone, very pessimistic, self-effacing. Patients will often value the opinions of others highly and base their own sense of worth on what others think of them. Treatments. Most sufferers of dependent personality disorder are keen to engage with treatments, as these are a form of depending on someone else. Treatments are often successful. Treatments can involve assertiveness training, encouraging assertive behavior so that the patient can take more control of their life. Group therapy. Group sessions in which all patients suffer from dependent personality disorder may assist in problem solving and patients sharing their experiences. Psychotherapy. This focuses on helping patients make decisions based on facts about the situation. Partial hospital programs. Patients can attend day programs with a group. There should be 5 sessions per day, focused on coping skills and psychotherapy. Histrionic personality disorder. Histrionic personality disorder involves excessive emotions, which may change very quickly with little warning. People with this disorder often gesture wildly and dominate conversations and events quickly. This personality disorder may appear in the patient's choice of clothes. People who suffer from it often dress to get the attention of others. They are often able to function relatively well, but may struggle to maintain positive relationships. Causes. The causes of histrionic personality disorder are unknown. Some researchers have speculated that suffering an emotional loss during childhood may contribute to it, but this is not currently clear. People who suffer from it may be unaware of their condition and will not often seek treatment unless their symptoms are severe. Symptoms. Some of the signs and symptoms of histrionic personality disorder include shallowness, interrupting others, preoccupation with medical problems or symptoms, impatient, highly impressionable, drug or alcohol abuse, demanding of others, manipulative, impulsiveness. Focus on appearances. Many people who suffer from this disorder are dramatic and constantly seek to be the center of attention, no matter what the situation is. Treatments. Histrionic personality disorder is predominantly treated through psychotherapy, rather than medication or other kinds of therapy. Therapy sessions should be one-on-one, given the patient's need to be the center of attention. Psychotherapy for this disorder should focus on solving the specific problems which the individual faces. It should aim to help the patient see themselves in a realistic light. The patient may find this attempt threatening, so it will need to be done with care. Narcissistic personality disorder. This disorder occurs when the patient has an unrealistic sense of their own importance and superiority. They believe that they are better than the people around them. They will obsess over producing perfect work and strive to outdo others and prove themselves. Patients suffering from narcissistic personality disorder often feel threatened by any sort of failure they face. Sufferers will rarely seek treatment and will often stop treatment as soon as they see minor improvements. Causes. There are no known causes of narcissistic personality disorder. Some researchers have suggested that it may serve as a defensive mechanism for underlying insecurities. Rather than recognize the insecurities, the patient convinces themselves that they are superior to everyone else. These insecurities may be the result of needs not being met during childhood. If adults were dismissive or failed to offer encouragement, the patient may feel inadequate and develop narcissistic personality disorder as a means of coping. Symptoms. Some symptoms of narcissistic personality disorder include lack of empathy for other people, focus on power, success, and achievements, exaggerating achievements and skills, arrogance, manipulation of others, self-centered or selfish behavior. Patients often expect to be treated differently. They may believe that rules should be broken or not applied to them because they are above others. Treatments. The narcissistic personality disorder is usually treated via psychotherapy. It is often difficult to treat effectively as the patient may only seek treatment when in a crisis and will often discontinue treatment when the crisis ends. Psychotherapy usually focuses on trying to help the patient see themselves in a more realistic light. This must be approached with care as the patient may see it as a threatening approach. They may also feel that their behavior is justified and they do not need to alter it. Obsessive-compulsive personality disorder. This disorder involves the patient seeing everything as either good or bad. A patient with obsessive-compulsive personality disorder will often be very inflexible in their behavior and thoughts. They may be a perfectionist. Patients often have poor social skills and may struggle to deal with anyone who has a different opinion. They may also find decisions difficult as they fear making mistakes. Causes. Though the causes of obsessive-compulsive personality disorders are unknown, some researchers believe that it can be genetic. There is a high chance of being diagnosed if a close relative has also been diagnosed. Others suggest that obsessive-compulsive personality disorder may stem from feelings of powerlessness. It might be a defensive response due to fear of being seen as a failure. Symptoms. If not treated, obsessive-compulsive personality disorder can lead to some major issues. It often causes depression and anxiety, and patients may find themselves unable to cope with general daily activities. Other symptoms include extreme focus on order, competitive nature, need for control, hoarding, hypochondria, rigid thinking or not open to new ideas, lack of humor, unable to express feelings, difficulty relaxing, formal manners, anger at unexpected results.